So tonight's original now with in-depth reporting on a topic we've been watching. And you know, it's estimated that every year in this country, something like 100,000 people get mastectomies. A lot of them are because the person is at risk of or already has breast cancer. But now, some insurance companies are making it harder for people who are already going through so much to get a popular type of reconstructive breast surgery. NBC's Emilie Ikeda has more.
Jessica Hezekiah found out she had breast cancer back in October of 2020.
You're stunned to know that at 34, I've got left breast cancer. So that started my journey.
After getting a mastectomy, removing her left breast, going through chemo and 33 rounds of radiation, she decided to get reconstructive surgery.
This was absolutely necessary for me. I kept my right one because there's nothing wrong with it. So when you have that unilateral appearance, it does something to you.
She opted for something called deep flap surgery, where a doctor uses the patient's blood vessels, fat, and skin from their stomach to reconstruct the breast without damaging their abdominal muscle. And for Jessica, the surgery was life-changing.
This is me again. I'm living, right? I'm no longer just going to my treatments. I'm a person again. I'm myself. I'm beautiful, right? This is my new mold.
Now, more breast cancer patients are choosing to get reconstructive breast surgeries. In 2020, about 17% were deep flap. Dr. Elizabeth Potter calls it the gold standard.
It's really the culmination of many years of refinement of surgical techniques, and it creates a lifelong reconstruction for a patient with living tissue that does not involve an implant.
A few years ago, Dr. Potter says the Center for Medicare and Medicaid Services changed the billing code for the procedure, prompting some insurance companies to drastically slash reimbursements for deep flap surgery, making it really tough for the average person to afford.
We live in the best country to have great physicians learn their craft, to be good at it, to provide you with the best outcome, least complications, to then say, but how much money do you have?
And paying out of pocket can be expensive. It can cost upwards of $50,000, according to medical experts.
Wealthy women around the country will always have access to reconstruction using their own tissue. Make no mistake about that. This insurance change is challenging the access of women who need care through insurance. And honestly, that's most patients.
Nearly half of people with breast cancer in a new survey called out-of-pocket costs a significant or catastrophic burden.
We didn't ask to get cancer, so I feel like the insurance company is taking away an option that we could have that would help us be more normal.
It's a little alarming and concerning. I've never faced something like this before where it was covered and now it's not.
The Women's Health and Cancer Rights Act from 1998 says insurance group plans that cover mastectomies must also cover all stages of reconstruction of the breast. So how did we get here? Congresswoman Debbie Wasserman Schultz, a breast cancer survivor herself, says a lot of finger pointing.
For this bureaucracy to have blown up the opportunity in many cases for women to have a less impactful, physically less impactful surgery that is going to use their natural tissue is just unacceptable, and they have to work it out.
We need to ensure that women around the country don't just have coverage, but have access to reconstruction. And we need to ensure that women around the country are fully informed of their options at the time of diagnosis.
Emilie Ikeda is joining us now. And Emilie, it sounds like there are a lot of players involved here. Where does the responsibility lie? What are we hearing in response to the concerns of some of these patients?
Hallie, a lot of moving pieces here. Dr. Potter says it will take the communication and cooperation of the federal regulators, doctors groups, and insurance companies to improve affordable access to deep flap surgery. And here's where the finger pointing comes in. Hang with me here, a lot of names. The Centers for the Medicaid and Medicare Services, a government agency that oversees the code, says the American Association of Plastic Surgeons requested the change. Well, that group blames insurers for limiting patients' access. And while several insurance companies we reached out to contend the change in code doesn't change patients' out-of-pocket costs. But critics say there's a ripple effect they're ignoring, because when reimbursement rates for surgeons are slashed by 50, 60%, Dr. Potter says surgeons will struggle affording the highly technical, lengthy surgery and stop offering it. Hallie?
It's an important story. I'm glad you're telling it for us tonight. Emilie Ikeda, thank you so much. Appreciate it.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.